All right, let's see. Find where Dr. Cameron Phillips is. Go ahead and enter the room. Hi, are you Dr. Cameron Phillips? Great, hi, I'm Chris Marcus. I am the pharmacy intern. Do you have a couple minutes? Great. Well, I am here to give you the information that you asked about your patient who is on warfarin, that you got an interaction flag for rifampin. Yes, all right. So let me give you an update again about the patient. So she's a 34-year-old female. She has a mechanical heart valve due to rheumatic fever, and she has been on warfarin at a weekly dose of 52.5 milligrams per week, and has been on that for a while, and her most recent INR is 2.6. I understand that you would like some more information about the drug-drug interaction warning that you received about rifampin and warfarin, and in particular what we should do about that. So I understand that we're using the rifampin to treat her infective endocarditis empirically at this time. We're still waiting for lab results on that. And the dose that you prescribed of rifampin was 300 milligrams by mouth, I believe, every 8 hours. And it was ordered today, so we should be starting today. So you are correct that there is a drug-drug interaction between those two medications. And it is an interaction of concern because the rifampin will actually increase the metabolism of the warfarin. So that results in basically a lower bioavailability of the warfarin, and ultimately it could lead to subtherapeutic levels of warfarin. So decreased warfarin effectiveness, the patient might be at more risk for a clot. So that is true. It's a very well-known interaction. And what we would need to do, there's a couple different options, but usually what is done is we would just make some gradual sequential increases in the amount of warfarin while the patient is also on the rifampin. And we'll need to also monitor the INR after that to see kind of where we're at dosing-wise. So yes, there is an interaction we should be aware of, and we will need to make some adjustments to the patient's warfarin. Do you have any questions for me? Okay, so I understand your question is basically, could we switch from warfarin to a DOAC like a Pixaban to, I assume, to avoid this interaction? Is that what you're thinking? That's a great question that I didn't actually consider or look into ahead of time. I would need to check to see if there is a drug-drug interaction between those, but I think I'd also need to assess if the DOAC could be used for the reason that we're anticoagulating the patient. My memory is that in patients with prosthetic valves, we probably wouldn't want to use a DOAC, but I can certainly check on that and get back to you. Great, well, thank you. Please reach out again if you have any further questions that I can assist with, and I will get back to you on the question that I was unable to answer. Thank you.